Good morning, dear students. So in continuation after the venous drainage, we will also try to see the lymphatic drainage of lower limb. The lymphatic drainage of lower limb, it is divided into superficial, like lymph nodes are grouped into superficial group of lymph nodes and deep group of lymph nodes. So in superficial category, we have superficial inguinal lymph nodes. Deep, we have deep inguinal lymph nodes, popliteal nodes, and anterior tibial nodes. So when you just look at this picture, the superficial inguinal group of lymph nodes are arranged in the form of letter T. Okay, so we have in the upper part, which is placed horizontally, we have lateral member, we have medial member, which usually upper horizontal group of superficial inguinal nodes, which are 5 or 6 in number. So this vertical group of the superficial inguinal group of lymph nodes, so it has 4 to 5 lymph nodes around. Okay, now, so this is superficial arrangement. Now, deep inguinal group of lymph nodes are 4 to 5 in number. So if you just remember the femoral triangle, the medialmost aspect of the femoral canal, we have studied there is one lymph node of Cloquet or lymph node of Rosenmuller, so which is one of the lymph node of deep inguinal group. Okay, as you go down, these are all deep inguinal group of lymph nodes. In this picture, we can also see in the popliteal fossa area, popliteal group of lymph nodes, which are 3 or 6 in number. In front of the tibia, we have anterior tibial nodes. So we know basically lymph nodes are nothing but the areas which are filtering the lymph, killing the microorganisms. The lymph is received into the lymph nodes through afferent lymphatic vessels. Once it gets filtered, it comes out through efferent lymphatic vessel, isn't it? So that's what. So lymphatic drainage of lower limb, we have inguinal group of lymph nodes, we have external iliac lymph nodes, okay? So superficial, deep, and popliteal nodes. Okay, so the lymphatic vessels, suppose when you talk about the superficial lymphatics, all these are the lymphatic vessels which are shown in violet color. So the superficial lymphatic vessels, they form cutaneous plexus. Finally, they will be draining into inguinal group of lymph nodes. Okay, the order of deep group of inguinal lymph nodes, they will be draining into tibial nodes, popliteal nodes, then they will be going into deep group of lymph nodes. So all these small vessels are nothing but lymphatic vessels. Through series of lymph nodes, these lymphatic vessels will be finally reaching the last group of lymph nodes. So lymphatic drainage, the superficial inguinal lymph nodes, deep inguinal lymph nodes, we have the lymphatics are arranged into superficial lymphatics and deep lymphatics. So superficial inguinal group of lymph nodes are seen in the inguinal region. This is lower vertical group. They drain the skin and fascia of the lower limb except the buttock and short saphenous territory. Then upper lateral group. So this group of lymph nodes drain the skin and fascia of the upper part of the lateral side of the thigh, buttock, flank, and back below the umbilical plane. Upper medial group of lymph nodes, they drain anterior abdominal wall below the level of umbilicus, the perineum including external genitalia, except the glands, the anal canal below the pectinate line, vagina below hymen, and penile part of the male urethra. The superolateral angle of the uterus via round ligament of the uterus. So now, deep inguinal group of lymph nodes, the superficial inguinal group of lymph nodes will be draining into the deep group, popliteal nodes also, and the glans finis or clitoris region. So this popliteal lymph nodes, they drain the territory of small saphenous vein and knee joint. So superficial lymphatics, the mainstream follows the great saphenous vein. So this is the great saphenous vein and ends in the lower vertical group of superficial inguinal lymph nodes, as I'm showing you with the arrow. Okay, and deep lymphatics, they flow, the lymph flows along the principal blood vessels and terminate mostly into deep inguinal lymph nodes. Now coming to the clinical aspects, elephantiasis. Suppose whenever there is obstruction in the lymphatic vessels, you see lymph will be leaking out into the interstitial spaces and it gets collected over there and it remains there for years together, as you see in Wuchereria bancrofti infection, that is lymph elephantiasis, lymphadenitis. Adenitis is the inflammation of lymph nodes. Now, few facts to remember. Long saphenous vein with saphenous nerve lies on the anterior to medial malleolus. We know this vein is used for cut open procedure, that is bypass grafts. Short saphenous vein lies behind lateral malleolus. Varicose veins are due to tortuosity of long saphenous vein and occurs mostly due to prolonged standing. Long saphenous vein is used to bypass the coronary artery after inverting by reversing the direction of valves inside the veins. Thank you.